Welcome to Why Should I Invest? Developed by the International Collegiate Angels Network, or ICAN. At ICAN, we believe that campus-born ventures are today's most underappreciated asset class. Each podcast will spotlight a campus-born founder and the venture they're building. I'm going to ask the tough questions that investors would want to ask. Welcome to another episode of Why Should I Invest? I'm Dr. Tom Duening. Today I'm here with Linh Pham and Siddharth UR. Linh is the CEO of LexiAI. LexiAI, what a fascinating company, is an AI-powered language access platform built for healthcare and enables real-time, accurate, and compliant communication between providers and non-English speaking patients. So Linh and Sid, welcome to the show. Please give us a little background on yourselves and how you came up with this wonderful idea for LexiAI.
Well, thank you so much for such a great opportunity. I can go first. My name is Linh. I'm the co-founder and CEO of Lexi. I was born and raised in Vietnam, and I speak 4 languages. I recently graduated from Harvard's Master in Design Engineering program, which is where I met Sid. We were in the same cohort, and we ended up working on multiple projects together, and we realized that we have a lot of shared missions, things that we care about, and also work ethics. And one of the things that we are really passionate about is improving the health outcomes for the immigrant communities. As both of us are immigrants, and we realize how big of a barrier language is for them to even just go about their day, but critically in healthcare. For example, the Vietnamese community, 1 in 2 Vietnamese people don't speak English well in the US. And that becomes a big barrier that affects their health outcome, have a lot of medical errors, pay $1,000 more per visit. So that's where we started our Lexi, the idea of Lexi, to really make the advancement of AI into something that can do good, but do well as well. And before Harvard, I worked in the tech industry for over 8 years. I work at a self-driving cars company, leading the design and product development. And I also work at NASA JPL on space data tools for Earth scientists.
Wow, interesting background. Wow. Sid, tell us a little bit about yourself.
Yeah, my name is Siddharth, co-founder of Lexi. I'm from India. I also speak 4 languages, some better than others. Have a background in healthcare product design and strategy. I worked at Philips Healthcare Research and Development, designing and launching products in India, Africa, and the US. A lot of my projects focused on bridging the health equity gap and how do we increase access to healthcare in underprivileged and under-resourced areas. And I think a lot of my motivation comes from growing up in India and seeing the societal imbalance in terms of access to healthcare and education between urban and rural really sparked that curiosity to go in and how could I use technology to bridge that gap. Moved to the US for my master's program at Harvard, where I met Linh. As she mentioned, we worked on a couple of different projects before we started working on Lexi together. Last summer, I did my internship at Mass General Brigham's Health Design Lab, working on redesigning their operation data workflows and working on some AI tools. And now after graduating, we're co-founding Lexi together.
Yeah, it's wonderful. And I'm going to brag for you, Sid. I have some information that was provided to me about your company and about you too. And Sid is one of a Forbes 30 under 30 individual for some of his work in design and healthcare innovation. So congratulations on that. And we're going to get into all the Harvard awards and things that you guys have won. But I want to learn more about LexiAI, and I know that your website which is withlexi.com, by the way, with Lexi, LEXI.com. You got a really good story on there about a young Vietnamese immigrant who was disadvantaged because she couldn't speak English. Could you share that story with us, Linh? And because it's so it's a tragic story in the end, but it really shows why LexiAI is such an important innovation.
Definitely. So in 2014, a 9-year-old Vietnamese girl was rushed to a California emergency room in excruciating pain. Her parents didn't speak English and no interpreter was available. She was misdiagnosed and given a drug her body couldn't tolerate. And hours later, she died. And this isn't just one story. Similar incidents happen all the time, even today, for 30 million patients in the US who don't speak English well.
30 million. Yeah, that's amazing. Yeah, I saw that statistic. And there's and not only does this impact these patients, but it impacts the clinics and hospitals as well, because they're misdiagnosed and so they have longer hospital stays and other kinds of things.
Yes, absolutely. Yeah, they face longer hospital stays. They have higher rates of medical errors. They have high mortality rates. And from the provider's perspective, they spend billions of dollars every single year to stay compliant. And yet the existing solutions are still inadequate. They face delays, they're underutilized, and they also inconsistent in quality.
Right. So tell me about the existing solutions that, I mean, so somebody comes into a clinic or a hospital situation and they're under some stress and strain and they're trying to communicate. And if I come up to a front desk in an emergency room or something like that, how would that be typically handled?
Right. You brought up a really good point on the emergency room scenarios. For emergency rooms, it's even more difficult because a lot of the time it's not within the working hours. So it might be less service. So
Yeah.
if a person comes into an emergency room, they might be bleeding. The providers would then have to come and might try to find a tablet on wheel to kind of try to connect to someone. The
Okay.
tablet might not be there. The tablet might be out of battery. Once they find a tablet, they would try to connect to a remote human interpreters
Oh, okay.
that in the off hours, maybe late at night, that might take up anytime between 5 minutes to like 25, 30 minutes.
Oh,
So that's
sure.
really putting a barrier between care to be able to communicate effectively in those moments.
Yeah. Well, tell us how LexiAI would integrate itself into that scenario.
For sure. Sid, do you want to take this one?
I can do that, yeah. So just to give context, as Tom mentioned, Lexi is an AI-powered language access platform that helps patients with limited English proficiency to have better communication with the healthcare providers. And we've designed Lexi to be platform agnostic so that it could be integrated across different touch points depending
Wow.
on the use cases. So Lexi could be integrated on a mobile phone, it could be integrated on a desktop, on a telephone, depending on a touch point. So in an emergency use case like that, Lexi could be integrated. If a provider has a mobile phone, they can quickly pull out the phone, click on a button, and they can naturally start speaking. So Lexi would real time pick up the provider's voice in English and real time translate it into patient's preferred language.
Right. So if I'm a receptionist in such a scenario and somebody comes in, they're speaking a language that I don't understand and I don't have anybody nearby that can interpret this thing, I immediately turn the Lexi platform on and it begins to help interpret. It interprets the communication.
Yes, voice to voice. Yes.
Yeah. So you got to help me understand this because this is a complex situation, and not only that, there's so many languages that this has to incorporate. So what have you guys done to sort of manage the myriad various languages that could present themselves in a clinical situation?
Yeah, that's a great question. As you know, healthcare is local and so are the language needs. So we're
Yeah.
starting with Massachusetts, which is one of the biggest states with a number of limited English proficients. And we look at the top 10 prioritized languages here, and that's
I
what we're
see.
focusing on in developing. And as we look through the list, of course, there are the common large languages like Spanish and Portuguese that are very well supported, but there are also other rare language but high demand like Haitian Creole, which honestly all of the not like big technologies are not supporting right now. So for
Can't
those
imagine.
languages, we're working directly with the immigrant community here, like Haitians of Boston. We also collaborate with machine learning engineers from Haiti to develop proprietary data set and models. And we launched the industry's first Haitian Creole voice AI interpretation, and it's
Yeah.
already been used right now in our healthcare partner sites.
Wow, I saw that. I thought I was fascinated by that. So what you do is you call those the long tail languages, right?
Yes, with the long tail languages, but those are really the bottlenecks. And at some point, in Massachusetts, for example, is the top three needs. So it's not even rare here
Right.
anymore.
Right. And you guys have some pilot projects underway.
Yeah, I can take that. So
Yeah.
we are actively piloting with community health centers and clinics. We
Uh,
last month we finished a first paid pilot with a leading community health center in Massachusetts. So we
okay.
just finished a pilot with Lowell Community Health Center,
Okay.
and Lowell caters around to 40,000 patients, and around 60 to 80% of the patients need some kind of language access.
Okay.
And yes.
And how did that go?
It was a great experience. We saw strong adoption with proven ROI. Within that 1 month, we had over like 12 users and over 300 sessions and 4,000 minutes of AI medical interpretation. And we started off with the optical shop in the ICAN center, and through the pilot, we expanded into health benefits conversation, community healthcare workers. And one of the provider mentioned that they only use Lexi exclusively and do not even reach out to phone interpreters for Spanish and Portuguese. It's super easy and intuitive to use.
Okay, so you're getting some good feedback, good customer data. And what other kinds of things do you have underway in terms of implementing this technology?
Yeah, so looking forward, we know that every health center and healthcare organization will have their own clinical workflow and systems. So for that, we are, as designers and researchers, we're actively on the ground. We visit our site partners every week to really understand, what are the clinical workflow and touch point, what are the existing
Yes.
staff behavior, so that we can build the product that not only is just technically advanced, but also fit directly into the clinical workflow and not adding any frictions.
Sure, I get it. And there's so much technology in a clinical setting. It's just there's so many different platforms that doctors use and so on. Does it integrate with all of this different e-health and different kinds of platforms that they use to manage their clinics? And are you guys going to be able to integrate seamlessly with the current existing platforms?
Yeah, we think that that's the only way to go. We don't want to just have like another device or like another, workflow that people have to learn. We really try to integrate into the existing workflow and systems, starting with things like the phone system, but also moving to other EHR as well, so that providers can have their existing workflow, but also have Lexi seamlessly integrate in that.
That's so smart. I mean, I'm so amazed at what you guys have created. And when I look at, and I'm looking at your deck, and I've read your deck, and I've read information about your company, it seems like you've thought of everything as you're part of the workflow and not upsetting the current ways that healthcare is being provided. But the question that comes up then, as a potential investor in a company like this, would be, how do you differentiate from translation tools that are already out and available via Google and other kinds of things? How are you guys different from existing translation tools?
Yeah, for sure. Sid, want to go?
Yeah, I can take that. So a lot of these general purpose translation are not designed for healthcare specifically. First of all, they cannot be used in healthcare situation because they're not complaint. They're not designed for two-way communication in a patient-provider context. So Lexi is designed specifically for healthcare. It's HIPAA compliant. It's medically fine-tuned for healthcare conversation.
Okay.
And Lexi is not just a point solution that just does translation. It's an enterprise-grade clinical solution that provides a lot more than just translation. It does usage tracking, it produces complaint artifacts, and it's an end-to-end solution that provides across the care continuum.
Very well said. Very well said. Spoken like somebody that's pitched before. I appreciate that. No, I'm kidding. But let's do a scenario. I come in, I don't speak your language, and you're the provider. You put a Lexi platform or a Lexi interface in between us. I tell you, I speak, I say what my condition is, what I'm feeling, and it translates it in real time for you.
Yeah.
Okay, and then you speak in a different language, and Lexi picks up your speech and translates it into my language. How does Lexi know what language I'm speaking?
Lexi is smart enough to know who is speaking and what language it is, so that it knows which language to translate to. And in addition to that, we know that there's also other types, the qualitative aspect of voice communication. So we also want to make sure that the voice sounds human-like, and it doesn't sound robotic. So those are the things that we're looking into.
Wow, that's amazing. So when Lexi hears me speaking, it immediately understands what language I'm speaking.
Yes.
And then it also knows what language to translate it into.
That is correct.
Wow. And so where does AI play a role in all this?
So AI is powering a lot of the underlying models to do the translation aspect, also transcription aspect, as well as the voice generation aspect. So it's a pipeline so that we can do voice-to-voice translation along with having transcription for every conversation, so that providers can even look back and see what has been translated and spoken about, which is something that right now with the existing solutions, they don't get access to. So we want to add additional layer of accountability on that side as well. And as AI capabilities get better, we want to make sure that we stay on top of, like the state of the art models. We have benchmarking pipelines to make sure that for every language we use the best models out there, and we also add our additional proprietary layer of data to improve the accuracy across the board.
Okay, great. So Lexi not only has a competitive advantage going in, but it's expanding its competitive advantage because it's learning all the time.
Yes, exactly. The more Lexi is used, the more it can get better. And as Sid might mention, a lot of these data are not being collected right now because it's multilingual. Most of the companies focus on English, and there are also additional touch points that are being missed as well. So as we get more data, we can make it better for all the touch points.
Okay, great. And when do you guys expect to be able to take Lexi to the marketplace?
So right now we already finished our paid pilot, and we are in discussions to start annual contracts with our customers. So it's live right now. It's being used daily, every day by providers and staff. And in the next 6 months, we are just hoping to even accelerate our momentum and partner with more healthcare organizations so that provide. And thank you in the social enterprise track. And it was a great experience. Of the mentors and the sessions were super helpful for us, not just the prize itself, but we learned so much along the way. And it was also very fun for us to be able to build with our friends at Harvard. We had a team of 5 team members across all the different schools: Harvard Business School, Harvard Law School, Harvard Public Health School, design and engineering. And we truly believe that is the multidisciplinary aspect that can help us think through every single aspect of Lexi as a systemic solution. In addition to that, because we are also designers and researchers, and we believe that design is important to make a product great, we won the IF Design Gold Award, which is the world's most prestigious design award, alongside with Apple, IBM, and Ferrari. And we were also very, very honored to receive that award.
What a team. That's fantastic. Who else is on your team besides the two of you?
So we're the 2 co-founders. We also have other amazing teammates. We have Danny, who leads a lot of the product development side and clinical relationships. We also have Jen Lee, who graduated recently from Harvard Business School, and she's been helping us with strategy, operations, and financial modeling.
Wow. Okay, great. And you guys have access to so many great potential mentors and everything. I'm looking at your revenue curve. You're expecting to be revenue about $100 million in year 6, according to the curve that's in front of me. And you are currently raising $750,000 to $1.5 million. Is that correct?
Yes, that's correct. We just kicked off our pre-seed round. We want to raise money so that we can achieve our next milestone of launching more clinical pilots, increasing the number of languages that we're supporting.
Right, and that's what my next question was going to be. What's the use of funds? Are you going to be hiring more team members, or expanding your team, or setting up a headquarters or something like that?
Yeah, definitely. So right now we are a fully remote team. We are always on site with customer, always developing products, and just going out to do more research. So we don't really need a physical space just yet, but we are looking to expand our team both on the product and engineering side, machine learning side, as well as the clinical operations side, so that we can reach more healthcare organizations.
Yeah, well, it's like I said, I'm really excited about this technology that you guys are developing. I think there's a huge need in healthcare for people with limited English skills, and to be able to provide this is just tremendous in the healthcare environment. So I always end each of these podcasts with a very simple question: Why should I invest in your company?
We believe that you should invest if you believe that language should never be a barrier to care, and that you want to make sure that healthcare is truly accessible for all, while saving hospital billions in operations costs, improving access for underserved immigrant communities, and improving health outcome for everyone.
Sid, do you have anything to add to that?
I was just going to say the same thing. So I think we really believe that this is a real social problem, and it could have a real financial returns. So we feel like this is something that could really bring in value and impact.
Yeah, well, congratulations on what you guys have built. Clearly, you've got good customer validation already. You've got validation from the various competitions that you've been in and the design awards that you've won. It seems like you guys are on a rocket ship. The website, again, is with Lexi, LEXI.com. I want to thank Siddharth and Lynn for joining me today. Thank you very much for being a part of my podcast.
Thank you so much for having us here and giving me the opportunity. Thank you.
For more information about how you can get involved in the ICAN mission, please contact me directly via email at tomdenning@icanhub.net.